Hello and welcome. Thank you for joining us for our fourth and final edition of our Roadmap webinar series. Today, I'm joined by many of our collaborative partners who have helped us to develop this series, and we're going to be delivering the final installment in this four-part series. It's really helping to put this all into context, how behavioral health services and home and community-based services operate together. My name is Meg Beyer. I am a part of the Technical Assistance Training Partners as I work at the McSilver Institute for Poverty Policy and Research, and I'm excited to get started today. So with that, let's kick this off. So I mentioned a few moments ago that we've had a really dynamic group of collaborative partners that have worked with us to develop this training roadmap and webinar series. As you can see, all of our partners are listed on this slide, and you'll hear from some of our partners who will introduce themselves as we go through the slides today. And speaking of partners, I'm going to actually pass along to my colleague Boris Vilgorin, who will take you through some of the next slides.
All right. Hello, everybody, and thank you for joining again the webinar. And just before we actually get to training objectives, just wanted to make sure, since this is, as Meg just mentioned, the fourth part of the series, this really is meant to tie everything together. So if you're listening to this as your first presentation of the series, we would strongly recommend that you first listen to the first three presentations, because this one is really meant, and you'll hear throughout the presentation, references back to some of the parts previously done. So our recommendation would be, that you listen to the first three first. And then come back to this one and take it from there. So just wanted to give people some context before we jump into it. But today's, the training objective, again, as I just mentioned, is to provide an overview of the mental health substance use disorder treatment of services, as well as the new kind of the behavioral health HCBS services that have been put out there, and how, they interact, work together, how would a care coordinator, a behavioral health provider, a health plan, or others, for that matter, could kind of, choose and have options and work with individuals on better serving them and better providing them with options, to meet their needs and their goals. So, so that's kind of what it's geared for the whole series, but especially for this one as we, kind of go through this. The way this presentation is going to work is slightly different than we have done in the past. It's really going to be predominantly focused through illustrations. We felt when we got together as a group that the best way to try to put all of this together is really through an illustration model rather through some sort of a conceptual. So we worked hard, and our partners worked very hard in providing, kind of thinking through vignettes of individuals with different types of, in different types of situation, goals, and needs. And those vignettes, by the way, will be available when this presentation gets uploaded. There'll be, we will not be showing the vignettes here. There'll be pieces of it, and our presenters will talk through some of that, but the actual vignettes will be available for you as well to download. And again, you'll hear the presenters reference. And the way the illustrations are laid out, just to give folks kind of a contextual piece here, again, we will talk through goals and needs and backgrounds of these individuals. We will then talk about some of the options and how some of the services and programs could meet those options, those goals and needs for the individuals, and and the options that the individual will have. Because in a lot of instances, it's not about just one type of a program or one area that could meet the need, and it's important that people have options. We will not be covering crisis in these presentations. We felt like this was more, again, there's a lot to cover even with what we have. And when folks do talk about crisis, I think it's also important to remember that each agency has developed or their own crisis processes and policies, and it would be very difficult for us to give examples and then really direct folks because we might be providing wrong information on that. And so we would strongly recommend, if you have questions or wonder how to handle, if you're with individuals who might be in crisis, you really should be talking to your agency's administrative and senior staff and supervisors to how you should handle it. So again, this presentation and these illustrations will not have crisis in them. And for OASIS examples, I think it's also important to note that the flow from the care manager to the provider, is important to incorporate to the locator, which really is, the tool that was developed and it needs to be used for the appropriate level of care. And we'll repeat that again, but this is for OASIS examples specific, or when we talk about substance use disorder services, you do need to make sure that, locator is part of that equation. And with that, what we'll do now is we'll pass this along to our one of our first presenters, who I think will talk to us about person-centered planning. So, Carla, please take it away.
Thank you, Boris. This is Carla Licio from the National Center on Addiction and Substance Abuse, also known as CASA and MCTAC. And I just want to take a minute to expand a little bit on what Boris was referencing regarding the locator. I just want to remind everyone that if you are a non-OASIS provider, if you are a care manager, if you are working in a system that is not certified by OASIS, and you are making a referral to an OASIS provider, you are not expected to use do the locator. The locator is a tool developed by OASIS to determine appropriate level of care for an individual at the time of referral. That locator that tool will be utilized by the OASIS provider that you refer to determine if this individual is in fact appropriate for the level of care that you have referred them to, or if in fact they need to be referred to a different level of care within the OASIS system. So I just wanted to expand on Boris's presentation about locator and to make sure everyone has a good sense of how that works. So to move on to this slide, I want to take time here to describe to remind everyone on the call that person-centered practices underlie all of the work that we do, and that in these examples that we give, we offer options and possibilities, but you will not see in our vignettes a prescription of what services a person must be referred to. You will see options for that person. And the reason that is the case is because the critical element of how a service plan gets developed, of how services get chosen for an individual, the critical element there is the conversation with the individual being referred and what their preferences, what their goals, what their desires are for services. All of those things have to be factored in when making a choice. And it is the person working with that individual, it's their responsibility to draw some of that information out, to make sure that they have an understanding of what an individual's preferences really are. Because as you will see as we go through the vignettes, there are many options within the service system on both OMH and OASIS side for many of these individuals. And so with so many options, it's really critical to bring in the person's individual life circumstances and preferences. What we've got here are some examples of questions that may draw some of those choice preferences out, such as, it's good to find out what may have worked for someone before. For some of the individuals that you're working with, they've been in care before. They've been in the system before. They have made use of services in the past, some of which they may have felt were really helpful, and some of which they may never want to use again. So find out about that. What worked in the past? What didn't work in the past? it's important to find out if a person's preferences are to work through some of their issues in an individual setting, or do they get a lot of benefit out of working with a group? Do they like to get everything under one roof, or do they have some preferences around providers that they don't mind going to different places for different services? What's important to them is that the individual or the organization that they're seeking to work with. How would that person describe the setting or the place that makes them most comfortable? Because remember, this person has to find a way to access these services. If they're uncomfortable accessing the services, that doesn't bode well. And then it's important to remember that all of the individuals you work with, they have lives that are bigger than accessing services. It's important to retain all of the critical elements of that life. So, do you have any special needs regarding transportation to the services? What hours are the best for you to access services? Things like child care, employment, other personal responsibilities all impact someone's ability to access care and to take advantage of treatment and services that are possible. So this is just a reminder to everyone that as you start to listen to the vignettes, you're going to see that every individual is different, and you're going to see that there are lots of options for individuals, but that it's your job to really work through with the person in front of you what is going to work best for that individual. With that, I'm going to pass this to my colleague Ruth, who's going to start with the first vignette. And of course, this passing thing, here we go.
Thank you so much, Carla.
Ruth, I think it's you.
All right. I think I've got the ball now, so this is great. All right, so let's talk about Maria. My name is Ruth Colon-Wagner, and I'm the Director of Training and Development with NYS. Our illustration today discusses a person, Maria, and she is HARP eligible. And we're going to go through the vignette together. Maria is a 35-year-old woman who was diagnosed with schizophrenia at age 20 when she was hearing voices that were demanding that she harm her youngest sister. A high school graduate, she was working at that time as a cashier at a local department store. Over the years, she had difficulty maintaining a steady job, and she struggled with managing her symptoms and drank heavily at times. Maria's mother learned about a local community clinic through a friend at her church, whose daughter also struggled with drinking. And she brought Maria to her first appointment to see a social worker at an OMH clinic. Over time, Maria had attended a number of OMH-certified programs, including clinics in IPRT, the Intensive Psychiatric Rehabilitation Treatment, and she also once attended an ACTIN, Assertive Community Treatment, for a few months. Maria is working very well with a social worker and a psychiatrist at a clinic program now, and her symptoms have been decreasing for about 6 months. She now takes her medication mostly as prescribed, has not had any aggressive acts towards her sister, and can describe the positive changes she is experiencing in her life. And although she continues to drink, she has cut back significantly to a frequency of about twice a week and hasn't binged in over a year. Her social worker was trained in integrated treatment for dual disorders and continues to work with her on her drinking. Last month, she moved back in with her parents and her sister in their apartment. Maria is ready to take the next step by returning to some kind of work, but she isn't quite sure what kind of job she would like. She's also worried about losing her benefits. From her experience in past programs, she met people who began to work, and she is very interested in exploring employment for herself. Maria wants to have a full and independent life and feel more confident about herself. She wants to work and to be productive. Her goals are to find a part-time job, to continue to manage her mental health symptoms, and to limit her drinking. Maria was contacted by a health home care manager 4 months ago, and after learning about the advantages, she joined a health home. She has Medicaid, has significant mental health and substance use problems, and is over 21. She was determined to be HARP eligible and received a letter telling her about this. Since she is in a HARP, her care manager explained that she may also benefit from additional services called home and community-based services that might help her to accomplish her goals. She and her care manager completed the 2-part community mental health assessment together, and this helped to determine that she is eligible for HCBS services and identified which ones she would most benefit from. The options to explore with Maria, we need to explore these options to Maria to bring in her life what are her preferences, what fits into her life, into her schedule. According to the assessment, they identified intensive supportive employment, and this is designed for people who want to work right away. Rapid job search and job placement, benefits counseling, developing and practicing skills related to managing behavioral health disorders to support the person and maintain and be successful in employment. The other service the assessment recommended was empowerment services, and that is designed to promote skills for coping and managing symptoms and to enhance the quality of her personal and family life. The other service that was recommended through the assessment was psychosocial rehabilitation, and this is to restore the person's functional level to the fullest extent possible. Other options to explore with Maria are clinics. So Maria is already enrolled in a clinic and is working with a social worker and a psychiatrist. As we said earlier, she is doing well, and her symptoms have been decreasing. A PROS program may also be an option for Maria. In addition to offering integrated rehabilitation and treatment, they also offer employment-related services. Although we know that Maria is doing well in her clinic, all options are explored with her. Then we have employment services that are not related to HCBS. And during webinar 3, we explored some of these vocational services. And just as a quick recap, they are supported employment services, assisted competitive employment, transitional employment, affirmative business industry, and enclave in industry. And lastly, the health home. Maria is qualified for a health home and is currently enrolled in one. Maria's care manager informed her that she qualified for the HCBS service called Intensive Supported Employment, and that this service could help her find a job that would be interesting to her and would meet her needs. She was given 2 choices of agencies in her area that provide this particular service. Together with her care manager, Maria completed her plan of care, which identified her needs, goals, and services that she qualifies for and that she is requesting. She will continue to attend her current clinic, which will help her manage her mental health symptoms and alcohol use. She will also begin working with an intensive supported employment provider at another agency close by. That was one of 2 options offered to her by her care manager. Her health home care manager will work with her managed care provider to make a referral and to coordinate her services. This plan of care was sent to Maria's managed care provider and was approved. And as Boris said earlier, this vignette, this illustration, is attached to this presentation, so you can download a copy of that. Now I am going to pass the presentation to Sapana, who will continue the presentation.
Thank you, Ruth. Hi, everyone. My name is Sapana Patel, and I'm from the Center for Practice Innovations. What I'll be doing is walking us through an illustration of a person, Pierre, who is not eligible for a HARP, a Health and Recovery Plan. So let's find out a little bit more about Pierre. Pierre is a 20-year-old man who has experienced serious depression on and off since he was about 12 years old. In addition to the history of depression, he quite often feels fearful and anxious much of the time. Pierre's guidance counselor first picked up on his social anxiety and constant worry that bad things were going to happen at school. And although he finished high school, he's never worked and spends much of his time at home with his family. He also does not have much social support or a friend network. Although he's not happy about this, he often feels stuck and paralyzed by the anxiety that leaves him feeling helpless and depressed. At this point, he doesn't know how to move forward. Now, Pierre's been provided with a variety of mental health services over the years. As I said, while in high school, his guidance counselor referred him to a school-based counselor who provided him therapy whenever he needed it or was feeling bogged down by finals or exams. After graduating high school, his guidance counselor and school-based counselor referred him to a child psychiatrist. And this person prescribed him medications because his depression got significantly worse when most of his peers from high school went on to college and he did not. This has helped him some, but both Pierre and his parents are not satisfied with his progress and steps that he's been trying to take towards moving on with his life. His psychiatrist has experience in working with agencies that provide OMH, Office of Mental Health certified programs, and agrees that Pierre can benefit from more than the weekly sessions that he has with her. So what are some options that we may explore with Pierre? Pierre is eligible for Medicaid and a health home, but he cannot enroll in a health and recovery plan or receive home and community-based services because he's not the age of 21 yet. Pierre and his family are exploring state plan options, and they've looked into a variety of different services. They've looked into clinics, ACT teams, assertive community treatment teams, and PROS programs, personalized recovery-oriented services programs. Clinics seem similar to what he's receiving now from his psychiatrist, so they aren't likely to meet his needs about school, work, or socializing. ACT teams serve people whose needs seem to be more acute and who aren't able or willing to attend site-based services. Pierre's goals really are to gain better control over his depression and anxiety, and he thinks that he'd like to go to college and maybe explore a part-time job but doesn't know what steps to take. Just thinking about this makes him very anxious, and he'd like to learn how to keep his anxiety and his depression more under control and not let them get in the way as much as it has in his life so far. And he'd also like to make more friends and eventually have a girlfriend. As I mentioned, Pierre and his parents are exploring these options. So one option that they felt was quite appropriate for Pierre was the PROS program. Now, PROS programs are designed to provide services that are individualized and focused on recovery, as well as the goals and needs of the person being served. Pierre, in a PROS program, would be able to meet with a prescriber and participate in a variety of group and other services tailored to his needs. He would be able to manage his symptoms. He would be able to explore getting a job and being more social, and even pursuing a relationship at some point. He could learn and do this through wellness self-management, receiving medication if he chooses, have people to work with to develop some social skills, and may benefit from supported education and employment services, which are a part of a PROS program. Pierre and his family have decided that the PROS program would best meet his needs. Other options that we should also explore with Pierre, in addition to a PROS program, may be employment services that are not related to home and community-based services, as well as a clubhouse, which is a community services center for individuals living with mental illness. Now, in this vignette and in this illustration, we wanted to explore a person who has options but is not eligible for a HARP. And these options include PROS programs, non-HCBS employment services, as well as a clubhouse. If it's helpful, as Boris referred to earlier, these illustrations are available as supplemental material that accompany this webinar. And with this illustration, I'd like to turn it back over to my colleague, Carla.
Thanks, Sapana. As we get started here, I want to explain that myself and Marcus Daugherty from CASA MCTAC are going to review the next couple of vignettes that focus more directly on individuals who are living with more significant substance use disorder issues. We wanted to present all different types of vignettes. So we're going to start with Nancy, who is eligible for HARP services. Nancy is 30 years old and has a long history of struggling with substance use disorder issues and mental health issues in the form of very significant depressive symptoms. It's important, though, to note right up front that with all of that, Nancy has also been able to move out of her parents' homes, live independently, and at times work successfully to support herself. In addition, she has been motivated to pursue a GED, although she has not yet completed it. So it's important I just want to highlight that for the purposes of the vignette, we will certainly identify the areas that Nancy seeks to get some assistance with, but that I want us to remember that Nancy brings many strengths to the table as well. So Nancy began using street drugs and experiencing symptoms of depression at the age of 12. She first sought treatment for substance use-related concerns at age 18 after an arrest for possession of marijuana and cocaine. She completed 24 months of intensive residential substance abuse treatment at that time. During residential treatment, Nancy attended GED classes. She just never quite got to taking the exam. Nancy worked off and on as a custodian and cook for a number of years prior to her most recent arrest for criminal sale of a controlled substance at the age of 30. Nancy reported that prior to her arrest, she had started using marijuana and crack cocaine again and had started drinking daily. Nancy was referred by Brooklyn Treatment Court to intensive residential treatment, which she completed in 18 months. Nancy was then referred to outpatient treatment, which she attended twice a week while seeking employment. Despite very concerted efforts of an active job search, Nancy still had not secured a paid job. She became suicidal and was hospitalized for 3 weeks. Following discharge from the hospital, Nancy moved into the home of a friend. She had multiple referrals for support following that hospitalization, but Nancy was not yet in a place where she could access those services. She was overwhelmed with depressive symptoms and her life circumstances. She no longer had a place of employment. She no longer had a permanent place to live. As a result, she did not attend her substance abuse program, nor did she take the antidepressant medication that she had been prescribed, and she missed several intake appointments for outpatient mental health services. She spent a number of months sleeping much of the day on her friend's couch until her friend told her that she had to leave. With nowhere to go, Nancy entered the shelter system and has resided there for the past 4 months. During that time, Nancy was referred to a health home, was given a care manager, and was determined to be HARP eligible. That care manager worked with Nancy for several weeks and convinced her to return to the Oasis outpatient program that she had been referred to. While living in the shelter and during this time, Nancy had tested positive in the shelter for cocaine and marijuana for several weeks and was informed that she would be discharged unless she received substance use disorder treatment. So under these circumstances and with her care manager's support and guidance, Nancy returned to her OASIS outpatient program. But there are many things that Nancy has as goals, and it is beyond simply treatment. So let's take a look at what Nancy is eligible for through HARP. Nancy's goals and needs include safe housing. She needs education about health conditions and the importance of getting health care. She needs to improve her self-worth and energy level. She needs to support, she seeks support to stop using cocaine and marijuana. And very importantly, Nancy is looking for employment. Options to explore with Nancy. And again, as I had spoken of earlier in this, it's important for this care manager, who is at this point Nancy's primary contact, to really work with Nancy around what is it of these things that are possible for her, what is it that best suits her needs. So Nancy could benefit from a primary care referral. Where and who that is would need to be something that gets negotiated with Nancy. There are programs through OASIS for housing. As part of her eligibility for HARP, she is eligible for HCBS services, where she can find support for employment. Nancy could benefit from the empowerment services. She could also choose to get community support and treatment as a way of accessing assistance for her mental health care. If those don't suit Nancy, Nancy could pursue treatment through clinics, both OASIS and OMH. It sounds like at this point Nancy has decided to pursue a clinic for her treatment of SUD, but she may decide to also pursue treatment for her depressive symptomatology, and she could do that through clinics. She could also decide to engage in a PROS program, which could address both her treatment issues and her employment issues, and a variety of other supports that she could use. So it is up to this care manager to work with Nancy through all of these options for her and pick the ones that Nancy feels are most accessible to her at this time. The other thing I'd like to say about all these vignettes is that this is also, all of this is a work in progress. Nancy may only choose to start with one or two goals. She may only choose to address one or two needs today. But then further down the road, she may say, you know what, I'm ready to take a look at housing, or I'm ready to take a look at employment now, and then that starts to get filtered in. So things develop over time, and these options shift and change over time as a person moves through their life. So with that, I'm going to take us to our next vignette, and I'm going to introduce Marcus Doherty. Marcus, do you want to introduce yourself as you go through Tariq?
Sure. My name is Marcus Doherty, and I'm part of the MTAC team here at CASA. What I would like to do with this vignette is to talk about Tariq, who is actually not eligible for HARP, but is eligible for health homes. So Tariq is a 47-year-old single male and former truck driver who was released from prison 7 days ago after completing a 5-year term for armed robbery. Prior to serving his prison term, Tariq used alcohol and cocaine daily. While using these substances, Tariq robbed bodegas to support his addiction. He was eventually arrested, convicted, and sentenced to prison. While incarcerated, Tariq earned a GED and obtained a trade as a carpenter. Tyreek continued substance use while incarcerated, and this led to several medical conditions. Specifically, his consumption of homemade alcohol led to the development of hepatitis C, and his eating habits led to the development of cardiovascular disease, diabetes, and hypertension. On the day of his release from prison, Tyreek was provided with refill prescriptions for medications to control his diabetes, hypertension, and cardiovascular disease. He was also provided with referrals for outpatient substance use treatment and for the neighborhood community medical clinic in the area where he will live with his sister Mercedes. Tyreek kept his scheduled medical appointment. His new medical doctor, however, changed his hypertension and cardiovascular medications. The medical doctor also changed the type and administration of his diabetic medication from metformin pills to insulin injections. His hepatitis C medication was not changed. Tyreek left the medical clinic confused about the changes in his medication regimen and with little information about how to manage his chronic illnesses. Tyreek also kept his intake appointment for outpatient substance use services. The substance abuse treatment provider recommended intensive outpatient services, meaning 12 hours a week of treatment. This seemed overwhelming to Tyreek, however. Tyreek has thought about returning to driving trucks for a living, but is unsure as to how to seek employment again in this field, since his commercial driver's license was suspended when he was incarcerated. He is unsure as to how to have it reinstated. He is also concerned about seeking employment, given his treatment schedule and his current medical conditions. He cannot figure out how to take care of his multiple health and behavioral health issues while seeking employment and getting back on his feet. So if we look at the needs and goals for Tyreek, we see that he needs education on his health conditions and the benefits of medical care to address his chronic health conditions. He also needs to consider finding a medical provider that will spend more time with Tyreek to educate him. This was particularly important given the fact that his medications were changed, but he's not sure as to why or what the benefits of the change or the reason for the changes were. Also, his need is to locate a substance use disorder treatment that does not interfere with his job search and employment. And then also keeping consistent with the person-centered approach, we want to incorporate as many things in Tyreek's life that are important for him. So looking at it from a holistic point of view, we want to make sure that things are happening in his life that are consistent with how he wants to live his life. Okay, another need or goal for Tyreek is also assistance with attaining employment. Although Tyreek obtained a trade while incarcerated as a carpenter, he's also thinking about returning as a truck driver, but clearly needs assistance in making a decision around which career path he wants to take. But if he wants to become a truck driver again, he needs assistance in having his CDL reinstated. And he also, a need for him would also be independent housing. Given that he's living with his sister Mercedes, he would also, or the care manager would also want to explore independent housing as part of his overall goals. So, and going to the next slide.
You're good.
Okay, the options to explore with Tyreek would be primary care referrals, okay, deciding with him the best medical providers that would meet his needs in terms of time and attention and really explaining his conditions and educating him. Also, an Oasis clinic that has evening and weekend hours, and this will be particularly important given the fact that Tariq does want to re-enter the employment world. Okay, so his Oasis clinic would really need to be flexible in terms of weekend and evening hours. He will also require employment support, again, to help him decide which direction he would like to seek employment in, whether he wants to go into carpentry or whether he wants to return to truck driving, or even explain further if he wants to consider another option in terms of employment. Okay, housing will also be an issue to explore with Tariq as well. And also Recovery Center for Social Supports. And this will be pretty important to explore with Tariq since he was incarcerated for a significant amount of time, coming back into the community and actually reintegrating into the community in a socially appropriate type of way, in a social type of way where he can, again, feel connected back into society. So those would be the options to explore with Tariq. And at this point, I would like to turn the presentation over to Megan.
Thank you, Marcus. Thanks for passing the presenter power back to me. I'm actually going to pass this along to Boris, who's going to talk us through the last two slides for the rest of our webinar today.
Great. Thank you, Meg and Marcus, Ruth, Carla, and Sapana for this wonderful presentation and vignettes and walking us through both the individuals, their goals, their needs, and as well as their options. I think, you know, it's very clear that, you know, as I think Carla and others pointed out, first, this is always person-centered. I think it's very important that, you know, when individuals explore their options, that a lot of different factors get considered. So as a perfect example, in the last illustration that Marcus just went through, when somebody wants employment, but they're going to a program all day long for many days during the week, that might not be, you know, the best match. And so those things need to be discussed. Also, you know, distance, directions, how far the programs and services are versus, you know, the types of these services, meaning, you know, are there more group-centric, individual-centric, or, you know, is there ability to receive some of these services at home or in the community? You know, all of those are important to all of us if we were looking for services, as well as for the individuals who we serve. They're not different, you know, when it comes to needs and goals and so forth. So I think it's all important, and putting it all together now, you know, again, as I mentioned in the beginning, you know, the first three presentations, especially the presentation 2 and 3, really take us through these programs and services in more depth. You know, so we strongly recommend, again, that you kind of go back and see, you know, get more acquainted with those programs and services. So this way, you know, you can have these discussions with the individuals you serve. So with that being said, we wanted to mention specifically for the adult behavioral health HCBS providers, if you know, if you're listening to this presentation, first, thank you, and I hope this is helpful as well. You know, we did want to mention that you as a provider still can make changes to your designation, you know, and these are some of the information, you know, who you would contact and how you would go about making those changes. There's also the manuals that are available for all. If individuals need more information specifically about adult behavioral health, HCBS, you know, overview of the services and so forth. So we wanted to share that. And also, as we have done with other presentations, if there's any additional questions, you know, please feel free to email either OASIS or OMH, and these are the email box number, emails for you to send those questions directly to them. And so with that, I want to thank again everybody that have participated in all of our presentations, including our state partners who have worked with us on this very closely and who actually presented as well in the presentations, and hope everybody who's listening will find this very helpful. So with that, again, thank you, and we will close this presentation as a series.